Medical professionals of Reddit, have you ever had a patient so lacking in common sense, you wondered how they made it this far? If so, what is your story? I'm a vet. A few years ago, I had a client bring his young cat in complaining of lethargy. Besides being a bit underweight, the physical exam was unremarkable, so I asked more questions about the cat's diet. Me: what do you feed the cat? Owner: online trendy raw food brand. Me: how is his appetite? Does he finish what you feed him? Owner: yes, he always eats everything. Me: how much do you feed him? Owner: half cup. Me: once or twice daily? Owner: once every 3 or 4 days. Me: you only feed your cat twice a week? Owner: I believe in a more natural feeding approach, and based on my research, that's how often cats eat in the wild. This owner was slowly starving his cat to death, based on some cockamamie idea he'd made up watching National Geographic. I had to explain to him that domestic cats are not tigers, and that small wild cats eat 10 to 20 small meals daily. Surprise surprise, the cat's lethargy and weight improved with regular feeding. I'm in the ER. So many stories. The one that left me dumbfounded was, a woman was brought in by her sister for pelvic cramps, amenorrhea for 3 months. Lo and behold, she's pregnant. Sister informs me that she sleeps with the Brazilian construction workers building the condo complex next door. I ask if they have any questions. The patient asked me if her baby would come out speaking Spanish. After a long pause, and her sister staring at the ceiling, I told her, no, because they speak Portuguese in Brazil. Patient seemed relieved, and the sister hustled her out of the ER before I could discharge her. Rural ER doc here. 35-year-old female walks in with right-sided jaw/neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to. 10 minutes later, oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. A friend of my mother's died from a wasp that got into his drink. He swallowed it, it stung him on its way down, and despite having no allergy to stings, the swelling was enough to close off his airway. I used to be a medical oxygen tech, mostly doing in-home work. One guy was on such a high concentration that he would have drawn nearly zero oxygen from breathing regular atmosphere. This required 2 heavy-duty machines hooked up in tandem, just to keep him barely alive. This was explained ad nauseum to him and his wife with full signed documentation of every conversation. They'd shut one machine off because they decided it was too loud. He'd take his mask off because he decided it was too cold. She would unplug the hose if she decided it was in the way. So on and so on, literally everything you could think of that would restrict or cut off his oxygen intake. Then they would panic and call our emergency service when he started to have a reaction to no oxygen intake. I lived not even 5 minutes away, right beside our EMS/fire station, and the call would always come to me to fix the machines at random times of the day and night, 3 to 7 days a week. They refused to call 911 because they didn't want to make a scene. This went on for ages, well over 18 months, until he was having trouble sleeping one night and shut the machines off before going back to bed. It's been years and I still see the wife around town. She always glares at me as if I'm the one who killed him. Saw a chart once where a person came in for a burn to their eye. They told the doctor they read online that warm milk in the eye can help with irritation, and their eyes were irritated. So they boiled milk and then poured it in their eye. Burned it all. Optometrist here. If I had a nickel for every time someone said they use urine for eye drops, I would have 10 cents. Which is not a lot, but it's weird that it happened twice. Not me, but my wife, who is a vet, had a client who got mad at her because he didn't realize that once he neutered his dog, that he wouldn't be able to breed it. As someone who worked at a vet office, I am completely unsurprised. We once had to explain what smegma was to very embarrassed owners of a new puppy who brought him in for discharge around his penis. Not to mention the countless people who bring their cats in asking about a lump, only to be told it's a nipple, and then you occasionally get the inevitable, "But he's a boy," and have to explain that male mammals have nipples too. Like, ma'am, you are married. Have you never noticed your husband has nipples before? This happened in med school on my OB/GYN rotation. Patient: who's the baby gonna look like? Me: what do you mean? Patient: Well, is it gonna look like the dude who got me pregnant, or the guy who's been nutting in me the last few months? Me, utterly speechless. The baby should look like the people who conceived it. This person is now a parent. Lady brings her baby into the ER with a rectal temp of 103. Kid sticky as hell, and looks like shit. Refuses all medications. Says she doesn't believe in them, and wonders why her herbal tea, she brought a jug of it, isn't working. Wants us to just check her out. Thinks a children's emergency room just checks them out. Try to explain why the kid needs an Nziad. Keeps refusing. Says she doesn't know what's in it. I bring up that fact, she had her kid in a hospital, and that she recovered medication herself, IV, epidural, etc. Doesn't budge. Only concerned for herself. Told her that, when the kid has a seizure or goes unresponsive and you call 911, you can expect the medics to give the kid everything it needs, regardless of whether you like it or not. Only when the doc threatened to contact social services for child endangerment and abuse did she start to listen. For like 5 whole seconds. Left against medical advice. People like this exist and breed. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of DN. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, "Well, he's still a virgin, and I'm not sure I'm comfortable with his virginity being taken in a hospital." "So, you're lactose intolerant?" "Yes." "And you knew this before?" "Yes." "And you drank a milkshake?" "Yes." "What size?" "Large." The rest of the night was the kid screaming and groaning in the ED waiting room. My sister told me a story of a woman with chronic blisters and lesions on her lips. They couldn't figure out what it was for weeks. It would heal and come back. Heal and come back. Turns out, she would jam out on, like 3 bags of salt and vinegar chip a day, for weeks at a time, until the sores hurt too bad to continue. Then she'd go to the doctor. Not me, but my mother would pick up shifts as a nurse, sometimes in labor and delivery, and she had met a handful of women who didn't know the baby was going to be coming out of their vaginas. Like no clue. My mom usually said something like, "How you got it in, is how it's coming out, honey." This was the late 90s, early 2000s. I'm a social worker and one of my clients literally kept getting pregnant over and over after having kids. And I had a frank conversation with her about birth control or getting her tubes tied, because she kept going through horrific births, only to get her kids taken away, and she actually said to me that she didn't know that birth control or safe sex would save her from getting pregnant. She didn't realize that sex equals pregnant, because she was SA as a child, and her father told her that she could only get pregnant when she's in love, and she had never been in love, so she didn't understand why she kept getting pregnant. Sex was only pleasure for her, so she didn't realize that was what was having her get pregnant. I worked ED for 10 years. Every day people come in, and it shocks you how they managed to evade death for that long. One of the worst was, we had a guy come in. He was at Win. He told us he needed to get checked for STDs, because his sister apparently just got one. We of course had to ask if he has had sex with her, and he said no. But they were twins, so what she has, so does he. After a collective sigh of relief, that this wasn't some weird Alabama "you're my sister" shit, we had to educate him, that is not how it worked at all. Had an 18 or 19-year-old girl come in my ER with some complaint that required an X-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex and there was zero possibility of pregnancy. We did the test anyway, and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant, because she'd never had sex. That was positive too. We gave her a few minutes to herself, to figure out what the hell happened, and when I returned to check on her, a short time later, she asked me if she could get pregnant even though her boyfriend didn't go all the way in. She 100% believed that long as his penis wasn't entirely in her, it didn't count as sex. It took nearly a half hour of explaining reproduction to her, for her to understand that whether it's halfway in, or all the way in, sperm travel. 73 here, former clinical microbiologist, long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So, one day, this 20-something guy, wife and mom in tow, walks in with a paper request for semen analysis, pre-computer era. Okay, Not the most comfortable encounter, but I'm a professional, and did this drill many times. He had not been briefed by the doc, and had no idea how establishing infertility in males was done. Well, okay, a challenge, then. I took him aside and, using standard medical terminology, told him how a diagnosis is made, and what he needed to do, to provide a specimen. He wouldn't believe, that I was asking him, to masturbate into the container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the toilet, with 2 inches of urine in the cup. God almighty. The report went back, patient provided improper specimen. Optometrist here. Patient booked in for an emergency appointment, with a raging red eye. Clearly very painful. Look under the microscope and the cornea is really not happy, wobbly reflexes, haziness, the works. Me, what happened? Patient, it's my niece's wedding this Saturday, and I wanted to tint my eyelashes to match my hair in the color scheme of the wedding, light blue, so I used the same dye for both, to match the color. Me, does that hair dye contain ammonia, by any chance? Patient, I think so. Do you think my eye will be better by Saturday? Will it match the color scheme? Me, unless you can convince then, to change the color scheme, to red, no. Edited because I read a comment about healing crystals and now I remember a story from a colleague. Patient attends a routine test, complaining of gradually reduced vision, which turns out to be due to cataract. My colleague offers referral for surgery. No need. Exclaims the patient. I know what I need for this. I have lapis lazuli at home. 6 weeks later, came back for the referral. Second edit, for remembering the first story, that made me question my sanity. Elderly patient attends with concerned family members, because the patient ran over a pop-up tent, in the side of the road, that the telephone engineers used to protect themselves from the rain. Luckily no one was hurt, as the worker was on lunch. Worried as to how the elderly driver missed seeing a large, red and white tent in the middle of the day, it was then, that the elderly relative, admitted to having spent the last 3 years driving from memory. Plenty, although the one that always sticks in my mind, is a patient I met during my early years, on a palliative care ward, suffering from terminal cancer. She was only in her early 30s, and the only reason she had gotten so far gone was, that she had relied on the healing power of crystals rather than, chemotherapy. Saw a similar story but worse, because it was a child with cancer, and parents who were convinced some vitamins would help, so basically the child just suffered and went on palliative. Admittedly, with chemo, survival rate was about 20%, but I still can't get over that they didn't even try, because their vitamins would do everything. EMS here. Had a diabetic in his 30s-40s, who refused to take insulin since 2012, it was 2020 at the time. When I took his blood sugar is only read as high, meaning it was over 700, for glucometer, to not read it. Upon seeing this, he asked me, if that was high, and then went, is this cause of all the ice cream I ate? Played Facebook Messenger video with his girlfriend the entire time. Met him later, on the parking lot, after he got discharged, and it took this man, less than 50 paces from the ER door, to rip off his bandage covering his IV, and play with the IV wound, until it started bleeding all over the place again. Knocked on our ambulance door and asked for a band-aid to fix it. We had to walk him back into the ER and bandaged his entire arm with gauze, so that, hopefully, by the time he got it off, it would have clotted enough for him, to not end up exsanguinating himself. Not a personal experience, but one from a colleague of mine. I only saw the pics. So, this 60-something-year-old, suffers from an acute complication, and gets a pacemaker to solve the problem. Everything goes normally and as planned, he recovers, every care and meds that he needs to take are prescribed, explained, and medical appointments with a cardiologist/arrhythmologist are scheduled, so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment, and never answer any calls from the hospital, to know of him and reschedule. This went on, for around 3 years. Until he shows up, without former warning, and asks to talk with the doctor that did the procedure to put his pacemaker. People are weirded out, but seeing that on that day, the doctor was present, and this patient was in clear distress, they talk to him, and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice, that this man is wearing a bra inside his shirt. The man explains, he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker, that should have been kept inside his body, dangling outside of it, being held by the left bra cup, with the big infected open wound above it, with the pacemaker lead still inserted onto his veins, and connected to his heart. Nobody has any idea how the man let that situation come to be, or how he didn't die of sepsis, or any other health problem that may appear for that matter. TLDR, man gets a pacemaker. Doesn't show up to appointments. 3 years later comes to the hospital looking for help, wearing his daughter's bra for 3 months, to serve as a holder for the pacemaker that got out of his body from his infected open wound. I don't know if cleaner in a hospital counts, but this one time, I got to work early on a Saturday morning, and we immediately received a request for help from the ER, and got sent over by my boss. When I got there, the first thing I heard was yelling from this guy behind one of the curtains. He was shouting at the nurses, "Don't touch my penis." And I didn't use any drugs. Then I smelled iron in the air and then I found out there was blood all over the hallway, handprints and blood against the wall. Almost the entire floor was covered in blood, with actual puddles in some places. What happened? The guy pulled out his catheter, causing arterial bleeding, and decided to run away from the nurses, who were trying to help him. It seems like he lived through that. I never seen that much blood before that day, nor after. I'm a pharmacist. One evening shift I was working a relief shift, not my usual pharmacy. A man comes in, looking distressed. Man, I had sexual relations with a woman I do not intend to pursue a long-term relationship with. Yes. He said it just like that. Me, okay. I'm assuming there was an accident or it was unprotected. How long ago did it happen? Man, last night, at 7 p.m. on the couch. Whoa TMI, I just need to know approximate time to know if Plan B will work. Me, we have this medication called Plan B, and since the incident happened within 72 hours. Man, oh yes, I got that for her, already yesterday, right after we finished. We want to know if there is anything we can do to know if she is pregnant now. Me, unfortunately not. She'll have to wait 3 weeks or so, to see if she gets her period, and if she doesn't, then she can do a pregnancy test then. Theoretically you could do a blood test for faster results, but that would also not be until a couple of weeks, at least. Man, we're just really anxious, because she really doesn't want to be pregnant. Is there anything that she can take to prevent the pregnancy? Any multivitamin? Minerals? Food? Me, she's already taken it, which was the Plan B. There are some other options but those are prescriptions. And no, there are no over-the-counter products she can take. Man, what about me? Is there anything I can take now, to prevent the pregnancy? Any multivitamins or minerals? Me, no sir. There isn't anything you can take now. I overheard a conversation between a nurse and a doctor and a patient in the ER. They were trying to figure out if he was very stupid, or has a head injury. It was both hilarious and sad. He kept telling them that he was there for a hurt leg. He couldn't explain why his leg was hurt, how it was hurt, how he got there. Nearly anything. I heard them taking in a hallway to each other. The nurse was convinced he hit his head. The doctor said, no, he is just an idiot. Turns out the doctor was right. They go a hold of the guy's wife. She basically told them, in the hallway, he is always this dumb, and if she leaves him, he would get lost in his own house and starve. Edit, it sounded like his leg was visibly injured or swollen. But when asked what happened, or how does it feel, he gave nonsensical idiot answers. Not like slurring, but in a regular idiot voice. If feels hurt, I was talking to Jimmy, and we were doing our usual work and my leg hurt. Doc, did something happen? What is the work? Him, something always happens, you know how it goes. I just want my leg fixed. This was one of the funniest, yet cutest one, was a student doing a shift in andrology/reproductive health. Doc, so you're trying to have kids, but not managing to. So, do you have any other kid? Patient, yes doc I have one. Doc, okay so we need to do this, and that. Patient, okay great. Then he proceeds to visit him and stuff, after which he goes away. After a couple seconds, he knocked the door again, saying, hello doc, my wife told me that it would be relevant to you, that the son I have is adopted, but that's make no difference to me. I always considered my own son. Paramedic. Elderly woman complains that her mouth is dry and she felt a bit dizzy, climbing the stairs earlier. Go through the whole rigmarole of getting a medical history, vitals, more detail on symptoms. Ask her what she's had to drink today. A cup of tea, 10 hours ago. Any water? No. Guess what fixed it, within 5 minutes? A woman called 911, because a cougar attacked her cat. She thought we could help the, very clearly dead, cat. A man called 911, because a cow bit him. He didn't want EMS or an assessment or anything. A man called 911 for an itchy butthole. Took him to the ED, because we have to. The doctor asked the patient if he had put the cream on his butthole that he gave him last time. Patient said no. Next time patient called us for his itchy butthole, I offered to put the cream on his butthole for him. He declined. Took him back to the ED. I've been a firefighter for 18 years. People call 911 for the dumbest shit ever. The following are all real 911 calls I've personally responded to. Toilet was leaking. Found corn in their shit. They admitted to eating corn. Cat in a tree. They threw up. They had diarrhea. They had a very mild cut on their arm. They didn't have a ride for their routine doctor's appointment. A bat got into their house. They locked their keys inside the house. They wanted us to change the batteries in their smoke detector. Their poop looked weird. They ran out of drugs and wanted more drugs, not the legal kind. And the guy who takes the cake? The guy who called 911 to say he was choking. He answered the door high as a Georgia pine, with a lit joint in his mouth. I asked him who was choking. He said, calmly, he was. He said he swallowed an ice cube and now he couldn't breathe. Just to be sure, and partly out of morbid curiosity, I looked in his mouth, then asked him to take a few deep breaths, which he was able to do easily. He still insisted he couldn't breathe. So I told him to make a pot of hot coffee, and then drink it. He asked me, why? I told him that the coffee will melt the ice cube and he'll be able to breathe again. Oh, cool. Thanks man. Then I left. Not me, but sibling. I don't think he'd mind me sharing the story, just on the off chance it prevents someone else from making this mistake. Lots of surgeons have a similar story, but thankfully this one doesn't end in someone's death. Parents claim their child hasn't eaten anything before surgery, as they were carefully directed. Turns out, they thought the surgical team was just being cruel to their child, and when she said she was hungry that morning, they detoured on their way to the surgical center, and got her a full southern breakfast. She damn near died, aspirating biscuits and gravy. I've rarely seen my brother so angry and disgusted. Somehow, biscuits and gravy looks even more nauseating the second time around, and he was just recounting what had happened. I have no doubt he tore a strip off the parents once their 5-year-old was stabilized, and they probably still felt justified and angry at the surgeon for telling them what they could and could not feed their child right before anesthesia. ETA, the parents did in fact feel justified and hard done by, although as far as I know, they didn't express anger at my brother. Knowing him, they didn't get a word in edgewise. Definitely no acknowledgement or realization that they could easily have killed their own child, or that they'd made a bad decision. I remember, they were annoyed by her whining for food. Working midnight in the ER. Family brings in a 4-year-old at 2 a.m. I ask them what is wrong. Them ask him, the 4-year-old. He said he needed to see a doctor. Me, did he say anything was wrong? Them, no. He said he needed to see a doctor, so brought him. A quick back and forth that firmly establishes that they actually showed up in the ER at 2 a.m., purely because the 4-year-old said he needed to see a doctor and they don't know why. Meet a child, why do you need to see a doctor? Kid, the doctor has suckers. Me, flushed face. To be clear, it is the parents who lack sense, and not the kid. Woman comes in with no prenatal care to labor and delivery and labor. OBGYN resident, taking a history, do you have any allergies? Patient, yes, I'm allergic to water. Resident, okay. What kind of reaction happens when you drink water? Patient, oh, it makes me pee. Yeah lady, that's a feature, not a bug. I work in clinical research at a hospital. Basically, for patients who have cancer and don't have other standard of care options, clinical trials, experimental treatment, are a viable option for many. Some people have a negative view of research, but it's highly regulated, and not as scary as it sounds. We go through the consent form with this patient, who has a history of drug abuse. We don't know everything about this new medication, but one thing we do know, is that using cocaine, while taking this drug, will make your heart explode, in layman's terms. This patient promises they're off the sauce, and that they totally won't do cocaine while they're on the trial. 2 weeks later, they relapse and, well, you can figure out the rest of the story. I'm a nurse. This isn't about a patient, rather than my dad. He is convinced that insulin is what is giving people diabetes, and doctors are prescribing it just to make money. After 30 minutes of telling him why that's wrong, he said, not to be so liberal, and I didn't understand, because I'm not a doctor. EMT, father-in-law does his own research, and has tried to tell me, on multiple occasions, that anytime we have to transfuse blood on the bus, we should ask the patient if they're vaccinated, cause if we transfuse blood from someone who has the COVID-19 vaccine into a patient that hasn't had it, then it could alter their genetic makeup and keep them from getting into heaven.